Well, our community is in Franklin County, Kentucky, and that's in the capital city of Kentucky, in Frankfort. And we have a population of almost 50,000, but we're always sure to point out that it is 49,285 to get in at those lowest FAB fees. And our health department has about 65 employees. We have a clinic, environmental health education, and we're a little bit unique that we also have a home health agency that we run. Well, for our community health assessment, or CHA, and our community health improvement plan, or CHIP, we followed the MAP framework, or Mobilizing for Action Through Planning and Partnerships. We love our acronyms. That was, of course, developed by NACCHO, and we followed that to a T. In 2008, our health department director, Paul Alexander, attended a MAP training and came back with that information for me, and we started very shortly thereafter, in about September 2008, with our first assessment, and we've just progressed since then.
Our community is Wichita, Kansas, and I work for the Sedgwick County Health Department, which is the county health department there. Our community is made up of about a little bit over 500,000 residents, and our health department serves a pretty diverse population, predominantly Caucasian population, but we have approximately 12 to 15% Black, and we have about 12 to 15% Hispanic, and then we have a smaller percentage of Asians that are also within our population. And our health department is made up of about 140 employees. Community health improvement is what they focus on. We also have the Children and Family Health Division, which is our WIC program, Healthy Babies program, and then we also have a children's dental clinic underneath that. We have our health promotion unit, and then we also have our preventive health division, which is our clinical services. So our community health improvement efforts consisted of us really using the MAP process, which I'm sure you're all familiar with. And we used that process to, for one, make sure that people were aware of the health issues in our community. Secondly, we wanted to make sure that they had an opportunity to create priorities based on their personal interests and needs. And then third, create a way that we could all innovatively work together in a better way than we had in the past.
I work for the Minneapolis Health Department, which is logically in the city of Minneapolis, which has about 400,000 people. My department has about 100 people, and we work in the full range from environmental health. We run some school-based clinics, and we do a lot of policy, system, and environmental change as well. We started our community health assessment and community health improvement planning process because the county that we're in was interested in getting going on their accreditation. And so they came to us and they said, since you have a health department that's inside our county, and we know that 3 other suburbs also have health departments, why don't we 5 health departments get together and plan both our community health assessment and our community health improvement planning process? And so we did, and we involved the hospitals in the area, we involved health plans, we involved community-based agencies, and schools, and we put a steering committee together, and they helped us create a larger list of people who then we engaged in 3 community meetings that began to give direction, and now we have an ongoing committee and several action groups that are implementing the plan.
I live in Billings, Montana, which is Yellowstone County in south central Montana. We have a population of about 140,000. We are the largest county in Montana, just to give a little frame of reference of our size. So our health department has about 60 employees that work in public health services. We also have a community health center, dental, healthcare for the homeless, hospice, home care. So we have a wide range of services, and public health services is just one of the divisions of that area. Our community health assessment and improvement process really started with the healthcare organizations in our community. So we partner very closely with our 2 local hospitals, Billings Clinic and St. Vincent Healthcare, to do the community health assessment. And what we've done for the community health assessment is we've contracted with a company to actually do it, and they do a survey, a random digit dial survey, and then focus groups. And then from that, we kind of move it to the community from there and hold some community meetings to help us choose priorities. We have a coalition that we call the Healthy by Design Coalition, and that's really our working group. So it's the group that takes those priorities, develops the implementation strategies, and then goes out into our community and tries to accomplish those implementation strategies.
Well, the health department in Sumner County has approximately 200 employees. We have an enormous amount of, education, information services we provide, starting with WIC, prenatal services, OBGYN, dental, as well as immunizations, family planning, STD, refugee health. So there's an enormous amount of work that goes on within the health department. In terms of the community, we collaborate greatly with a lot of community partners. We have about 450,000 population. It's about 68% white, about 18% Hispanic, and 12% African American. Well, our community health assessment and improvement planning efforts, we started with MAP, which is mobilizing action planning partnerships, it was a great endeavor. It encompassed a lot of healthy leadership, healthy seminal hospitals, faith-based institutions, and we basically looked around what can we do to improve the community. So we focused a lot on community themes. We actually had a good timeline and did focus groups. At the heart of what we really found out was that there was health equity and social determinants of health that we needed to look at. We found that through the data, which was births. We used youth births data as well. And then we looked at some other measures. And from that standpoint, we really saw that we had some work to do. Now, from the community health assessment, we actually decided to go with obesity as being the one determinant that we really thought would focus more on diabetes, heart disease, and other areas. So we felt we would lump it in through that way. And so that's been almost a 6-month endeavor, but we still have a lot of work to do in that area.
Our health department is located in northwest Atlanta, Georgia. It's composed of 2 counties, Cobb and Douglas, with a total population of about 850,000 people. We used MAP and the Community Balance Scorecard for our community health planning efforts. We started back in April in 2011 with the kickoff. We did parallel MAP processes in both of our 2 counties. We felt it was very important in order to have a quality process that we have advisors. So we worked with people from the Northern Kentucky Health Department and also DeKalb County Health Department, both of whom had a lot of previous experience with MAP to help us. We also had benefit of significant help from Julia Jo Ellikers with NACCHO and Teresa Daub from the CDC.
I work for Kittitas County Public Health Department, which is in central Washington, eastern Washington state. It's a smaller county in Washington state. We have about 40,000 people. We have seen a big population influx over the past few years, a lot of people moving out of the urban areas and into the more rural areas. It's a primarily agricultural community, although less and less so over the past few years. The health department that I work in, we have about 21 staff, 17.75 FTE, and that's to serve a population of about 40,000 people. We have an annual budget of about $1.1 million, which has steadily declined over the past few years as well. So in 2011, we received a grant from NACCHO to be a demonstration site for community health assessment and community health improvement planning. We started by convening a group of about 30 plus community members and people representing different agencies, different organizations, different groups in the community. We convened them and described the process that we were looking to undertake. We started with the community health assessment. We followed the MAP guidelines, the MAP framework, and which was really helpful for us because it has a focus on being very community-based, which was of interest to us. We have a small community. As a health department, we're used to doing things that involve our community as much as possible, and that's really what we wanted to get out of the assessment. So the MAP framework worked really well for us. We completed the community health assessment and then moved into the community health improvement planning piece, all within about a 12-month period. If we could have had more time, we would have probably taken a little bit more time. It did feel a little bit rushed because we did a lot of work in that time, but it was a lot of fun and we accomplished a lot of our goals, learned a lot of lessons, and we look forward to doing it again in a few years.
The Northern Kentucky Independent District Health Department is a medium-sized health department. We have about 150 employees and 6 sites throughout a 4-county health district. We're located on the Ohio River, right across from Cincinnati, Ohio. And we have everything from urban core to suburbia to rural areas. And with all of the different geography, we get the benefits of that as well as the challenges that come with that.
We started doing community health assessments way back with Apex back in the early 90s. And in 2000, we were a demonstration site for MAP. And when we did the MAP process then, being very new at it, not quite knowing what we were doing, we very much followed the book, and the health department took a very strong central lead in the assessment and planning process. The second time we did MAP, we have a community organization, it's called Vision 2015, and they have a broad community planning process, and part of that, their Healthy Communities objective in that was to do a community health assessment and planning process. And they asked us, with the expertise in the public health and knowing the MAP process, to take the facilitating lead in that. So it was very much a community process the second time, with the health department just taking the facilitation. We were part of that in that we participated on it, but our main role was to be the facilitator.
I think that was really kind of an innovative approach to embed our community health assessment as part of a larger community collaborative and visioning process.
Our community is a smaller community in Texas, a rural community, if you will. We have a population for our county of about 140,000 people. We have 5 cities within that county, and some of our services we provide just in a city, some we provide for up to 15 counties. Our health department has a budget of about $5.6 million. $2.2 million of that come from grants, which is almost half. We have about 78 FTE on staff with us, and we do a variety of services. We are considered a full-service health department. We started our process for the community health assessment, the community health improvement planning 5 years ago, and that was with attending a MAP training session. Our director went to the training session in Tennessee, and then I went the next year when it was in Ohio. And so that really kicked off the process for us, and we were committed to the MAP process and actually being strategic in what we were doing as a health department. We knew that we were switching from kind of some primary care roles over into the prevention side, and that MAP would help us kind of focus and be strategic in how we were going to meet those objectives for the future. And so when she came back from her training, we talked about it and met with our Board of Health and brought them up to speed on what it even was and how to the concept of it. And then we started in on the assessments, and we did the National Public Health Performance Standard Assessment Initiative in 2009. And that was quite a process. And from there, the first thing that came out as the top objective for us was that we needed a community health assessment. We had no idea how healthy or unhealthy our community was. We had a general idea, but no data to support that, and certainly no document and nothing to share with the community. We just had an indication based on what we thought we knew. And so from there, we partnered with a local university, Midwestern State University, and Dr. Kirk Harlow and I worked on the community health assessment, and that was released as a 36-page document in 2011. No one reads 36-page documents other than people in academia. So we released a subsequent health facts, which was a shorter version of that, in June of 2012, and it was better received. And then from there, we formed a health coalition, which was the very first time in our small community that many people had gotten in a room together, which was quite interesting. It's been such a positive experience. And they were the ones in the last 7 months to come up with our community health improvement plan.